Life is complex.
So is our mental health. It cannot be understood by diagnosis alone.
Our philosophy is treat the person, not the mental illness.
Hello, everyone, and welcome to another episode of Humanizing Mental Health. I'm flying solo today. My co-host isn't with me. We are very grateful for the opportunity to be able to meet with and have Dr. Jeffrey Smith on the show with us. This is an individual who fundamentally sees the world of mental health on the same lines that we do. As we always say, treat the person, not the illness, that our lives are much more than just simply a diagnosis. So welcome to the show, Dr.
Thank you very much, Jeremy. It's a pleasure to be here. And yes, I definitely think we are on the same wavelength here.
So I'd like to start by you giving us a little bit of background in terms of what you've done within the mental health field and kind of how that led you to an understanding of the limitations of diagnosis as the driving force for treatment.
Sure. So I wanted to be a therapist when I was a freshman in college and decided to go on through medical school and residency and so on. And so finally, I got to begin practicing a long time now ago. And I began about 2010 to write a blog, and it got to be the go-to place for people who had experienced intense attachment to their therapist and felt like if they didn't have their therapist, they would die, or that strong. And I began to hear, as people wrote in, I began to hear stories of just terrible things happening, like the patient would finally get around to get the courage up to share with their therapist that they had these strong feelings. And then 15 minutes later, the security guard would show up and tell the person, I'm taking you out of the clinic. We're terminating the treatment and you should never come back. And so somewhere around 2015, about 10 years ago, a little more, I realized that the field is in trouble, that we really need better ways to approach psychotherapy. The divisiveness into different varieties of psychotherapy is unnecessary, and it complicates things. And the end result is there's a lot of really mediocre and frankly bad psychotherapy that goes on, and especially with today's trend of treat the diagnosis instead of the person, that people come in and they say, I have depression. And I'm dismayed when I hear that, because I want to hear, I'm feeling blue, or things are really looking bad, and I'm not sure I want to be on earth anymore. Something like that I can relate to, because they think that just giving a label is going to tell the doctor what to do, and it doesn't, because people are much more complex than that.
Yeah. Wow. It's almost like across the miles that are between us that we've been walking a similar path. That fundamentally, as I've looked at the limitations of the diagnostic manual, I was like, well, first of all, where's the science? Like how is it that we're forming these? There's so many diagnoses are so caught up within our cultural processes, expectations of what's normal, and really just taking the human experience and going, that's a disease, and that's a disease.
Well, a few of us at SEPI, the Society for the Exploration of Psychotherapy Integration, crazy name, but it's been around for 40 years now. A few of us in that organization got together and we asked a question that, as far as we can tell, nobody's really thought about much, which is, what does psychotherapy treat? Because most of the answers you'll hear are answers about, what does psychodynamic therapy treat? Well, okay, intrapsychic conflicts or something like that. What does CBT treat? Well, it treats irrational thoughts and things like that. And so there isn't really any agreement, and that makes it very hard to be able to take techniques from different therapies that are better suited for a given individual and combine them. And so it got us to thinking about the infrastructure, what's underneath all of those current theories, which are just fine, but they're incompatible one with another. So we thought about, let's narrow it down to just psychotherapy. And what does psychotherapy treat? Well, psychotherapy is designed to change things in the way the mind processes what's going on. And that means it's about information. I want to talk later about how information means something very different for me than it does maybe for the average person. It's not ones and zeros. Information is much richer than that. But in any case, we thought about how does the mind process the things that are going on around it and come to conclusions. And so what we came up with was a very simple formula that really describes the things that psychotherapy treats. And that is, we call them entrenched maladaptive patterns, EMPs. And it turns out once you do that and you start to look at them, whether it's anxiety or a attachment pattern or a pattern of relationship, no matter what, all of those patterns are responses, and they're responses that come from the survival-oriented mind that is in humans is very similar to that of dogs and other mammals. And so the other thing that is in entrenched maladaptive patterns is the word entrenched. And that's really important because what happens is that entrenched means that those patterns are hard to change. And why are they hard to change? Well, the inner mind that's oriented towards survival is looking at its cherished solutions to problems in life as things that are life and death important assets, and it doesn't want to let go of them. And so when we come marching in and say, hey, I'm your therapist, and I want to change some things about how you operate in the world, maybe the conscious patient client says, yes, that's great. But the deeper, non-conscious, subcortical, survival-oriented part of the mind says, oh my gosh, I don't want to lose that. That's terrible. And it develops then its own set of and more entrenched maladaptive patterns to try to protect against change. And that's the work of psychotherapy. And that's why it takes a really strong relationship, because what's going to tell a person that it's okay to try something new? Well, it's having somebody you trust who says it's going to be okay.
Yeah, yeah, absolutely. Like this to me is absolutely amazing. It's like we get in, we connect as a therapist. Often we can see things and we want the person to get better. We can see where that path goes and maybe even how to get there. And then we go, why is this person resistant? Why is this
Hmm.
person resistant?
Hmm. And they should be. And where it leads us to think of entrenched, it leads us more to not just to see the resistance as a difficulty or an enemy or something to be overcome. It's a part of the mind that we want to befriend. We want to connect with that part of the mind. We want to respect that what is better described as a person than a thing, because it really operates. And when the inner mind is facing a difficult problem, it becomes frozen in time. And at that point, it kind of separates and it becomes has its own agenda, which it wants to follow, even if that's not what the conscious mind thinks is a good idea. For example, anybody who's tried to lose weight understands very well what happens when the inner mind wants one thing, because maybe there's going to be a famine tomorrow, and so we better eat as much as we can. And the conscious mind says, no, 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 that's not going to happen. It's okay. And the two of them are at odds. And it's also interesting to notice who owns your motivation ultimately, who usually wins if there's a back and forth there.
Mm-hmm. Yeah, and I guess then one of the fundamentals of what psychotherapy does is to help those parts of mind that are in conflict actually be able to join together.
Hmm.
Yeah, for sure. Like it reminds me of a recently an individual that had been really working on people pleasing behaviors and was so concerned about how they would make other people feel. And so I tried something. I turned around and took an empty glass and was like, okay, I'm gonna pour a potion in here. And this potion is going to take away all of that anxiety, all the fear, all the concerns that you have about hurting other people's feelings. So all you got to do is drink it. Will you drink the potion? And then they sat there and were like, nope. I said, okay, let's have a real conversation then about this.
Hmm.
You
Hmm.
do, you're not going to want to remove this. I get it then. I'm not going to try
Hmm.
to remove it.
Hmm.
So, but what is it doing? Like not in some twisted way of,
Hmm.
but what is actually this doing for you? Let's understand what it's doing and what would happen if we took it away.
Yeah, that absolutely, and that's where the humanism and the art of psychotherapy comes in, is communicating with that inner mind that's nonverbal, that operates on metaphor and connotation and imagery, and if we're able to tune in on that wavelength, then we're in a position to have a real conversation.
And I think it comes back to what you were saying about the relational piece, that all of a
Hmm.
sudden there's trust. All of a sudden it's like, I'm not going to make you do anything. I'm with you on the ride and we're going to figure it out together. Being able to say that and say, maybe what we want to do here is instead of trying to remove it, maybe this is just like a stereo that's playing too loud.
Hmm.
Maybe it's just all the way up and we just need to dial it back. Maybe this still needs to be part of your life, just not so big in your life.
Yeah, that how big is so important, because I think very often those patterns that are maladaptive are really answers to life and death problems, and that things that were a life and death issue, like not having enough love when you're really little and you need that, you need that in order to grow properly. That's a life and death thing. And when that becomes frozen in time and brought into the adult present, then the scale is huge. And so what we want to do with our relationship is say, well, maybe it's at this point in your life, really, it's not a life and death thing. We lower the stakes.
Yeah. Yeah, like tremendous, right? Tremendous. You said something and it's really important, at least I think. You said the art of therapy. Like we got to remember that this is a soft science. Like we try to jam it into this medical model to make it fit.
Yeah.
That's like I
Yeah.
want if you're okay with that, can you speak a little bit more to what you mean by the art of therapy?
Well, I'd love to. I take a kind of a scientific approach to the art, which may sound contradictory, but it's not. And I think fortunately we see that with AI these days, because AI uses fuzzy logic. It's not precise like mathematics. It weighs things and goes with probabilities and so on. But the best illustration, to my mind, is in the U.S. here. We have advertisements on television for pharmaceuticals, for medications, and what you see on the television screen is you see these happy people and they're smiling and dancing around, and there's music and color and beautiful people and relationship, and all of these things are telling you this medication is going to make you feel just great, and that is attuned to the inner mind. That's the language of the inner mind. And it takes art, and it's complex, and it's far, far richer than what you'd find in a scientific article or something like that. And then simultaneously, the advertisers are required to say what the side effects are. And so they drone on in a very boring way about this drug can kill you. But they know that if they say it like that without the color and the brightness and all, that the inner mind won't even notice. And that's where motivation is. And so we can take a lesson from that and realize that when those two parts of the mind get separated, then we're really going to need to speak the language of the inner mind and realize that it's a very rich language. And one of the things about it is the inner mind, since it's survival oriented, is pretty good at watching out for being tricked. And so if we go in like salesmen, then then we're going to get eliminated immediately. So we have to be
Hmm.
authentic and real, unlike advertisers. But we still have to speak. We have to be able to understand and communicate in a language that makes sense there, in a language of imagery or experience, like you did. Like you said, about the potion, that was a metaphor, and it spoke very well to that part of the mind. So I see the art really as very understandable in terms of information, in that it's this rich nonverbal form of information, like a picture is worth 1,000 words. But in order to make any headway with in that language and that kind of information, it really requires that we tap into our own intuition and our empathy, and that we respect our client and the way they express things and understand things.
Yes. Now, that brings me back to something you said earlier, and that is that you said about relationship. Can you speak more to how you use that relationship within your process?
Well, so I'm always what I've been talking about recently is that if there's one thing that helps in the course of doing psychotherapy, and it's really what I do all the time, is seeking accurate empathy. Accurate empathy I define as an ever deepening, emotionally engaged, detailed understanding of the other person's experience, as close as we can get to understanding another human being, and keep on working to get closer. What does that do? That builds a relationship. It builds a relationship of trust and understanding. And so that's what I'm trying to do. I'm working to grow that relationship. And that involves then talking about, what do we both want here? How I'm understanding you, I'm listening to you, I'm respecting you. And so it builds a relationship, and that's very important. There's one other thing though. When the inner mind gets split off, sometimes it's a very young mind. And I've been working with people with dissociative identity disorder since the beginning of my practice many years ago. But even in other people who don't have dissociation, very often you see kind of characteristics of very young ways of thinking and approaching things. And so the way I think about it is sometimes it's like there are three people in the room. There's me, there's my adult client, and there's a little kid there who is trying to survive and trying to hold on to that old pattern that they have. And so I have a dialogue with both parts at the same time, and I try to enlist my adult client in accepting and respecting and even loving their own inner self.
It makes me curious because as you talk about that, I had wondered as soon as you started talking about pieces of the mind, I wondered how much like internal family systems is part of kind of your style of working with people.
Well, the short answer is it's certainly, I think my experience with dissociation has really influenced me to be interested in and understand that the inner mind often is different and distinct and separated in our work from the regular adult person. And in that sense, I think that internal family systems therapy contributes a lot that way. One of the things that I think is interesting is I've changed the way I think about the word transference. We therapists, if you'll listen to the traditional definition of transference, it's like a distortion. It's like seeing the other person as if they were like somebody that we had a relationship with in early life. But a distortion of reality is a very simple, oversimplified, and limited way to think of that. And the way I think about it now is most of the time I'm really looking at a young part of the mind that has its own agenda, that's operating towards what it considers to be survival and doing its very best to protect the person. And so an example is, I think often midlife crises that people have. Really, what brings on a midlife crisis is that non-conscious inner mind begins to notice that, wait a minute, I've had my agenda. I've been waiting for the moment that I'm going to be able to achieve what I've been waiting for all my life. And time is beginning to fritter away. I'm going to be too old pretty soon. And so all of a sudden there's a crisis that seems to come out of nowhere. But it really comes because that inner self not only has an agenda, but is also watching how that agenda is playing out and whether it's really going to be achieved or not. So it's a much richer, more three-dimensional, even having fourth dimension, having a dimension of time, a much richer phenomenon. And so I'd rather think of an inner self with an agenda than to think of something so simple and limited as transference.
Yeah, for sure. Like I remember thinking about this, and because early in my career, I was very much so into cognitive behavioral therapy, simply because I found it to be so effective. Someone comes in, they have a concern. There's a lot of logic that fits into the intervention that would work. But then there's some people that would come back multiple times. They may see me for a while and they come back and they didn't seem to have moved through the issue. And then I delved more into a deeper understanding of attachment, a deeper understanding of how that influences humanity and the developmental reality of humans as fundamentally attachment creatures. And started to understand, okay, what you described in that inner child is like this playbook that we have that we don't even know exists. It's just there.
Hmm.
And until someone can peel the onion a little bit, and often people would say to me, I don't want to talk about my childhood, and say that's okay. We don't have to. It's just they're like, I can tell you all these things. I don't feel any distress.
Hmm.
And be like, actually, I'm looking for the part that you don't understand. And and being able to come to that and help them to see that programming actually, when you make it overt, it can actually, you can find true freedom. How are we
Hmm.
free if we're
Hmm.
just playing
Yeah.
out our past
Yeah.
in these unconscious ways?
Yeah. Yeah. So true, and it's people's initial reaction when we talk to them about, well, maybe there's a part of you that has a different agenda, is, well, I don't want to get rid of that, and they feel ashamed, and so
Yeah.
the first job is to say, well, wait a minute, if you are harsh with a child, and we're dealing with a child much of the time, if you're harsh with a child, are they going to learn? Are they going to grow and change? No, they're just going to freeze up and hold tight. So we're really going to have to make the leap of respecting and even loving that part of yourself.
Um,
And it makes therapy much more effective when you do that.
Totally. Like I often think about this as most of the things that happen in our life that leave some kind of mark, they happen relationally. It's a
Hmm.
relational thing that brings that about. So does it not actually make sense that it would also be healed in a relational way? That you set the environment in the therapy room to allow the relational process to
Hmm.
heal. Like you talked about transference. To me, that's not actually a problem, just as you
Hmm.
described it. It's like it's actually the relational injuries that we want to come
Hmm.
out so that we can do something with them now.
Yeah, it's a solution. That's not a problem. I'd just like to take note that there are situations where it's not relational. Like, for example, adult trauma. You know, when an adult is like in an automobile accident or something like that, and we hear what Peter Levine says about getting stuck in a physical response that can't be completed and needs to be. So, but the relationship is still essential for the healing.
Yeah,
But,
sure.
you know, so when piece of experience has been walled off, sometimes I think much of the time it's a relational experience, because that's the big challenge about being human, is managing the complexity of our relationships.
Yeah, yeah. Absolutely. Absolutely. That totally makes sense to me. Mhm. So I I gotta say this conversation so far has been amazing. The feeling back and forth, the resonance,
Yeah, yeah, yeah.
that sense of attunement. Can you tell me how you actually came to a place where you realized that you're like, okay, we need to move beyond the diagnosis? How when you sorry, let me reframe that. What was the response in the community, in the mental health community, when you were pushing to move beyond diagnosis?
My papers were turned down administratively from the journals that I wanted to publish in. There's been a fair amount of resistance. I think because the most of the people who are in positions of influence are academicians, and in order to have an academic career, you have to do research, and do research you have to specialize on something very narrow. And so if people have kind of decided, okay, this is my thing, this is what my career is going to be based on, and I'm coming along and saying, wait a minute, I think all of these distinctions are pretty artificial, and I love what you say and appreciate your technique, but there are other ways of doing the same thing. That is uncomfortable for a lot of people, but increasingly. I've been president of SEPI just the previous year, and I've gotten to the position where I am in the American Psychiatric Association, and finally did get published. And so I'm making headway, and I think reaching out to people who are younger and people who are more open-minded, and people who've been out there in the trenches like yourself as clinicians, where when you're actually doing psychotherapy and working with people and trying to help when things are not easy, then anything that's going to be useful really kind of wakes you up and makes you take notice. So I feel like I'm making headway, and I'm very appreciative to be able to be a guest on your podcast. That's one more place to reach out to people and tell them that psychotherapy is not as mysterious or complicated as we think. Human beings are complicated, But the therapy itself and what makes people, how people heal, is that we know a lot more about the science since the 21st century, and it's not terribly complicated.
Absolutely. And this, as you talk about that and you to describe that, it makes me also wonder then about, you see all these things on TikTok, on all these social medias where people are pushing out all this information about diagnosis. They're pushing out about
Hmm.
ADD, pushing
Hmm.
about autism. Like I certainly am not trying to diminish anyone, but at the same time, in the 22 years that I've worked, I've seen these movements around what gets diagnosed, and they are very fad like
Hmm.
in the early 2000s. Bipolar disorder was diagnosed all over the place.
Yeah.
Attention deficit disorder became really popular. Right now it's autism,
Yeah.
and the position in which people are seeking an answer.
Yeah.
I'm concerned right now that that there's a counter message in the world to what we're trying to say, and that is,
Hmm.
you need the essence of healing is understanding self, and you're not going to find that in just
Yeah.
a diagnosis.
Yeah, I think the thing that dismays me the most, and I think one of the reasons why people grab onto diagnoses so avidly, is that then that leads to a magical solution. I've been following a young man who's not a young man anymore now. He's middle aged, but for a decade, who's been just struggling and getting nowhere because all kinds of practitioners are giving him this diagnosis and that one, and then giving him a magical treatment. It's transcranial magnetic stimulation or heavy duty medications and this thing and that thing, and each one is promised to this is going to cure you. It's going to make everything fine, and it's not, because the fundamental problem is this is a person who's afraid of making decisions on his own. He never had a chance to do that growing up and hasn't learned, and so everybody keeps, including this person, keeps grabbing for a magical solution that's going to be easy, that isn't going to require any hard work, and everything's going to be fine, and they don't exist. And so then we have lots of people disappointed in the mental health system because it overpromises. And so I think that's really sad. At the same time, there is a lot of understanding. And I mean, one of the things I love about CBT is that even though my own background was more psychodynamic to begin with, but CBT helps people learn new coping skills. And when you change a behavior, that sends all kinds of interesting messages into your inner mind about that life doesn't work exactly the way you thought it did.
Yeah, yeah.
So there are good things out there, but there sure is a lot of a strong tendency to want to. I don't want to know about anything outside of my consciousness. I just want to know about what I can control consciously, which misses out on a lot. And I want a solution that somebody's going to give me some potion that's going to make everything just fine, and I won't have to do the hard work. We're fundamentally, our minds, our brains are oriented towards avoiding uncomfortable feelings, whether those are unconscious uncomfortable feelings or conscious ones. When
Yeah.
we're facing tough stuff, I just saw somebody very recently, a man who had an affair, and he was having terrible time trying to reignite his marriage after his wife found out. And I said, what you guys really need is to have a heart to heart, deep down, real conversation, and just open up the whole can of worms and be realistic with each other. And they did. And he came back a second time and said, well, things are okay now. It's all right. It's all better.
Mm,
So
yeah. Yeah, right?
yeah, they did the hard
Mhm.
work and it worked.
Right, right. In fact, I was going to ask you a question about that. Like, in the course of your work, have you seen people heal?
Oh, yes. I mean, that's one of the reasons I got interested very early in how therapy works, which is the name of my Substack and my website, is because when I finished residency, the teaching in those days, this was in the mid 70s, was that trauma is something that's just for military psychiatrists. It's not really of any interest to the general psychiatrist. And the textbook of psychiatry said that incest is an exceedingly rare phenomenon. So that was the atmosphere. Well, shortly after I finished residency, I was working in a hospital and began to see people who had had serious trauma in their lives. And I really didn't know what to do. How does trauma heal? And so I had all of the volumes of Freud's work on the shelf. And so I said, all right, let's pick up volume 1 and see what he said. Turns out that Freud was a good trauma therapist. He understood a lot and wrote very nicely about it. And what he said was that all you have to do to heal trauma is make the unconscious conscious and in with feeling, and then it gets better. Well, he missed a few things. First of all, he was working with people who were dissociative, and so when for him, for those in those early cases, bringing traumatic events to consciousness really meant bringing them, undoing dissociative barriers that had been there since the trauma originally happened. So the traumas came out completely fresh as if it happened yesterday. And that's exactly what I was experiencing in my practice. But the other thing Freud missed was that he was a good Victorian scientist. And I think we forget a lot that many of the traditions of psychotherapy come from the Victorian era. And in those days, a Victorian scientist thought that the scientist was a purely objective observer and wasn't in any way influencing the thing that he was observing. And that's why, the blank slate and all of that stuff is to keep from influencing the system that you're observing. Well, that's all nonsense. And the real part, the healing ingredient, was his presence as a calm person who was empathically connected with his client. And that's why it worked. So anyway, it taught me early on to be interested in how people heal. And eventually in 2004, I wrote an early paper about that, about Freud's healing and how the relationship element in it was missing. And so I forget where I started this story, but I think that comes very close, and I can say more about modern science about how healing actually takes place. But those are the ingredients that we work with, and they're amazing. They're effective.
Now, I want to track back to something you said at the very beginning. You said that you have a a different definition of, it was right at the start of our conversation. I remember
You mean
connecting with
entrenched
that.
maladaptive patterns?
So at the
Yeah.
very beginning, information. You said you have a different
Yes.
different definition
Okay,
of
well,
information.
yeah, and what I meant was that the way the brain, now we know, since Eric Kandel won the Nobel Prize for describing how the brain encodes information. And what it does is it really depends on the strength of a whole lot of synapses and connections between neurons. And so it works the same as the artificial intelligence that recognizes your handwriting when you go to the bank and cash a check. There are many connections of varying strengths, and what the science of it says that neurons that fire together wire together. And so what you have is a clump of neurons that tend to fire together as a unit. And that is a chunk of information. And that chunk of information will then have associations to other chunks of information that are maybe weaker or stronger or even positive and negative. And so the whole thing is very fuzzy. And information is a chunk of information, which could be a weird feeling or a look or a color or a sound or a word, the verbal part of a word or the visual part of a word. There are many of these things, and they all have connections to one another in a very rich kind of matrix. And so that's why, if you remember back to that drug advertisement with the beautiful people and the color and that's so rich. That's what I mean by information. It's that kind of very, very nuanced, extensive network of connections that actually represents things and allows one thing to represent something else, like a metaphor, very easily. That's very natural for the non-conscious mind. So what I like to say about that is that our basic survival apparatus works like that and uses pattern matching. It's very simple. Pattern matching that reminds me of something that I've seen before. And that's how that non-conscious mind operates and processes information in this simple mechanisms, but very complex mixes of data. And so that's what we started with, and that's what our survival depends on. And then because when it deals with relationships, which is, animal survival is mostly based on fighting off predators, but human survival is all about managing relationships, which is infinitely more complicated. And so that old pattern matching survival oriented mind doesn't always come up with the right answer. And so what evolution does is it comes along, this is the way I think of it, evolution comes along with this thing called consciousness and reason. And reason sort of counterbalances and the hope is, from an evolutionary standpoint, if you have two completely different systems, one is reasoning to come up with answers for how to live, and the other one is non-conscious survival-oriented answers for how to live, that the two of them are going to work it out together and somehow come out with a better answer than either one alone.
Mm, mhm.
And so I think of consciousness as kind of a counterbalance, but it's really a fancy add-on that we humans have, presumably. And the basic mind, the one that owns our motivation for the most part and that makes a lot of our decisions, is that non-conscious part that's that's concerned with survival
Sure.
and has this rich way of processing information.
Yeah. So what it means then is that we need to stop fighting that. As individuals, we need to stop fighting. Fighting isn't going to get us anywhere. If you
You
fight
got it.
yourself, you're going to lose. So really what you're talking about is integrative
Hmm.
therapeutic processes. That, like you said
Yes.
that earlier,
Yes.
but that's one of the big
Yeah.
pieces of the integration then is that internal motivation, that unconscious self integrating
Yeah.
with the conscious self.
Yes. One of the places I learned a lot about this was my second job was running an alcoholism clinic. And so I had the opportunity to sit with a lot of people who were in early recovery who had just become abstinent and they wanted really they didn't want to relapse. They wanted to hold on to their abstinence and become sober people. And so there they were, and what I began to notice was how their inner mind communicated and tried to influence their consciousness, because they would have an idea, a person whose life had been completely ruined by alcohol would have this idea that, well, maybe I'm not an alcoholic. Maybe I'm not really an alcoholic. And, or maybe I could just have one and nobody would notice and everything's going to be okay. And pretty soon they relapse. Well, to me, that was the inner mind convinced in its own way, for whatever reason, that drinking alcohol was synonymous with survival. And it was doing its very best to try to steer the person towards the next drink. And when I stepped back and looked at it, there were just three things that the inner mind did to communicate with the conscious mind. Thoughts would pop into the consciousness from who knows where, and that's what CBT knows as automatic thoughts, right? Feelings. I have this uneasy feeling. I just feel uncomfortable. I need something to make me feel better. So feelings is another way that the inner mind communicates with consciousness and tries to influence it. And the third one is impulses. And the alcoholics would say I was going down the street and all of a sudden my legs just turned right in and I went into the liquor store. Just happened. Another kind of impulse that's very important is impulses not to do something, because I like to make sure that we don't forget that arrested development happens when people don't do things, when they don't challenge themselves, when they don't try new behaviors, when they don't experiment in life. That's what causes arrested development. And that's a big part of what we do in psychotherapy, is helping people restart their growth. So anyway, those are the pathways by which I think the inner non-conscious survival oriented mind really works hard to try to influence our consciousness and is quite successful in doing it.
Yeah, that is makes so much sense to me. And I got to tell you that it has been an absolute pleasure to have you on the show. When they first connected, I was like, "Oh, this is a person I got to see." And then of course, along the way there was some snags and hookups
Yeah,
but
yeah.
I'm telling you it's worth it. The wait was entirely worth it.
Good. Well,
So
before we sign off, can I show people my new book?
yes, actually, it's funny because I was just going to say, everyone that comes on our show, we vet people to know is this someone that we want to support because we know that everybody that is here has a message. There is something that
Hmm.
they want to be able to get out into the world. So we always do a shameless plug. So it's time. It's time, Jeffrey,
Okay,
for the
good.
shameless plug.
Okay, here's the shameless plug. It's going to be on pre-order on August 3rd, and the publication date is August 25th. And this is a book that's intended as a companion for therapists to kind of share with them the art of psychotherapy, how to be a warm, engaged human being at the same time as being a therapist, and then the science of that I've explained quite a bit of how this all works and how it all makes sense, and how that sense making applies to every one of the 1,000 different therapies that are out there. So it's attempting to improve the quality of therapy that goes on out there by giving people powerful ideas that are going to help them understand what's going on and match it up better with the characteristics of the person that they're working with, at the same time as it encourages them to be human.
Absolutely. And for those that are listening and don't have video, that is How Psychotherapy Works is the title of
Right,
your book.
exactly. And I'm just I'll mention my Substack, which is where I have most of my content actually, and that is howtherapyworks.substack.com. And there's a lot of material there, and it'll lead you to all kinds of interesting things. I speak mainly to therapists, but there are a lot of thoughtful consumers that also find this interesting and helpful, as well as other kinds of helpers like coaches and things like that.
Yeah, totally. Totally. I think that actually understanding some of the frameworks of how the therapy is going to evolve in the room makes a massive difference
Hmm.
for the person that's receiving that therapy, for them to have a framework around which to understand how it's going to work. So books like this, I think, are much broader than just the professional. I think there's a lot of people that can
Yeah.
gain help through
Yeah, I
that.
think one of the major causes of dropout is that therapy doesn't have a focus or a direction. And when you understand what's going on, you can't help but have a focus and a direction.
Yeah, absolutely. So, on that note, thank you again. Do you have any final thoughts before we sign out?
Well, my the seek accurate empathy and love that little kid inside.
Wonderful. Awesome last words. All right. So, until next time, this is Jeremy Alcorn signing out.
Thank you so
Thank you for joining us today. We hope that this message has been as meaningful to you as it has been to us. If you're looking for help, you can find us on Facebook at Humanizing Mental Health.